Hi everyone, I'm Reena Chokshi. I am the Director of GI Motility at Baylor College of Medicine in Houston.
And my name is Sujka. I'm an assistant professor of GI surgery over at the University of South Florida. Thanks everybody for your attention. We're going to move now into sort of the part talking about interventions for gastroparesis itself. And specifically, we're going to focus on two particular branches of them. One is pyloric-directed therapy, and the other is going to be gastric-directed therapy. We're not really going to talk about feeding tubes, and we're not really going to talk about Roux-en-Y gastric bypass or sleeve gastrectomy as treatments, though they do exist. But we're specifically going to focus on what does gastric electrical stimulation mean, what does pyloric therapy mean. And so just as a brief introduction, if you're not familiar, Entera is a neurostimulation device for the stomach that includes a battery and two leads that go to the stomach itself, and it delivers electrical pulses to the stomach as a means of managing nausea and vomiting. And this is what it looks like. We will eventually go through a video later of placement. It also comes with a programmer that allows you to adjust the device, which is one of the things I think is really valuable about it, is that it's reversible and adjustable. Whereas, on the other hand, you talk about pyloric therapy, which is a permanent procedure. Once you cut that sphincter, there's no putting it back together. So if you have a patient who ends up with dumping syndrome, bile acid reflux, or other complications, there's not really a way to fix it outside of more surgery. And that's not to mean that I don't do pyloric therapy. I do GPOM and pyloroplasties all the time. But the way that I present it to patients is, generally speaking, a permanent versus a reversible procedure, or in some situations, combination therapy.